Alright everyone, Dr. Rajeev here. Welcome back to the channel. Today we are tackling a trio of common foot foes that I see quite often in the clinic. Corns, calluses and warts. While they might seem very similar at a first glance, they are actually very different in their causes and how we approach them. So let's shed some light on these troublesome spots so you can better understand what might be going on with your feet. First, let's talk about corns. Think of a corn as a foot's way of saying, ouch, there's something rubbing the wrong way. A corn is essentially a small, concreted area of thickened and hardened skin that makes it distinct with its usual dense central core, sometimes referred to as a nucleus, that presses painfully into the deeper layers of your skin. It's the core that often feels like a sharp pebble or a stone that is persistent point of pressure. Now, where do these pesky corns pop up? They tend to develop on non-weight bearing areas of the foot or in areas where there's direct pressure or friction against the bone. Common spots include top and sides of your toe, especially when they rub against ill-fitting shoes. You might also find them between your toes, particularly in the fourth and fifth, where they can rub against each other. When you touch the corn, it will feel like a firm and raised lesion. Applying direct pressure will often elicit a sharp and localized pain right at the core. Visually, it will look like a small circular or oval patch of thickened yellow or whitish translucent skin. Next, another important one is callus. Think of a callus as your foot's broader defense mechanism against repeated friction and pressure. Unlike the localized nature of a corn, calluses are more wider, more diffuse and cause generalized thickening of your skin. It is your body's ways of toughening up an area that is constantly under stress and pressure. Calluses typically develop on weight-bearing areas of the foot. Now, such areas like sole, especially under the heel and the ball of the toe, they also appear on the sides of the feet or if their shoes are causing widespread rubbing. You might even get calluses on your hands if you're doing activities that involve repeated friction, like weightlifting or gardening. When you touch a callus, it feels like a firm and often less sensitive area compared to the surrounding. While direct pressure might cause some discomfort, it usually lacks the sharp pinpoint pain associated with a corn. Usually, a callus appears on a larger, flattened area of skin. The edges generally are not well defined compared to a corn. The key takeaway from callus and corns are they are caused by friction and usually pressure, usually from ill-fitting shoes, foot deformities or repetitive action. The difference lies in the size, location, intensity and the localization of the pain. Finally, let's come to warts, the odd one out in the trio. Now, warts are difficult ball game completely. Unlike corns and calluses, which are caused by mechanical friction, warts are caused by a viral infection, specifically the human papilloma virus or the common skin wart virus. These viruses infect superficial layers of the skin and cause rough, bumpy growths. Plantar warts are typically commonly seen on the soles of the foot because they are on weight-bearing surfaces and they can get flattened and pushed inwards. Sometimes involves a thick layer of callus over them. They can make them tricky to distinguish a simple callus at the first glance. However, some telltale signs of a wart are, if you look at them very closely, probably take a picture from your camera, a clear picture and then zoom in, you might see a small black dots. These dots are generally within the wart. They are usually tiny thrombosed blood vessels that are the key characteristic appearance of a wart. Unlike the direct pressure that causes pain in a corn, squeezing the wart from the side often elicits more pain than pressing directly on the top of it. Wart appears anywhere on the foot, but they are commonly on the sole, heel and toes. They can even appear on your palms. They often occur in clusters known as mosaic warts. Because they are caused by virus, they are potentially contagious and risk of transmission can be there. To recap, corns, small concentrated areas of thickened skin with a painful center, usually on non-weight bearing areas and cause pain on direct pressure. Calluses, large, more diffuse, thickened skin typically on the weight-bearing surfaces, providing a broader protection against friction. Warts, rough, bumpy growths caused by viral infections, often present with a small black dots inside them, painful while squeezed from the sides. Understanding the differences is the first step towards addressing these common foot issues. In future videos, we will discuss how to diagnose, how to treat this condition, or how to manage this condition. Remember, if you're unsure of what you're going on with your feet, it's always better to seek professional opinion. Don't try to treat yourself aggressively, as sometimes it can lead to complications. Thank you for tuning in. If you found the information helpful, please like this video, subscribe to the channel for more foot health tips. Feel free to leave questions in the comments below and I'll do my best to try and answer them. Take care of your feet and I'll see you in the next video. Thank you.